a lot of parents, when they come to me after 2.5, they tell me that suddenly, ma'am, I'm seeing these developmental delays in my child, right? So, and the main focus is that suddenly it has happened,
Yeah.
right? Autism doesn't happen suddenly. Development delays doesn't happen suddenly, at least technically and scientifically,
No.
right? Have you seen something like that? Have you faced something like that?
Yeah. See, what happens is by 2.5 in India, typically, children can go to either a toddler group or to a preschool. So, usually, when this child who has these delays, this child is taken for admission to either a preschool or a toddler group or a play group. The teacher there would have noticed some issues because the
Hmm.
teacher would have seen other children who are typically developing, who are neurotypical, and this child who is different from the rest of the group and behaving differently, not able to speak, maybe hyperactive, extremely picky eater, not socializing with other children, not playing with the peers, being isolated. When the teacher sees all this, typically, since I trained preschool teachers, I have seen this happening. I mean, the teachers have told me, ma'am, some children do this, some children do this. So this is what they tell me. Ma'am, why does this child not talk to others? Ma'am, why does this child doesn't like to be touched by us? Ma'am, why is this child pushing other children? Why is this child biting other children? These kind of questions. So the teachers notice, they don't know why these children. So what happens is the teacher flags the parents, or the teacher flags the principal, and the principal calls the parents for a meeting and expresses concerns. Then the whole at concern going to a doctor, then going to a clinical psychologist, or coming to a center like ours for assessment, the whole cycle starts. So when, if that is the only child at home, if this child is the only child at home, and the child does not have any other siblings or any cousins or anybody at home, parents can't understand that the child is delayed, or the parents are not trained to observe developmental delays. It's a first time child. I mean, I have a child with autism. I didn't know what was going on with Varun till I the first symptom I saw was speech delay. Till then I didn't know. Only now I'm able to recall ki, oh, he had that, he had this. I can now connect the dots, but now, before that I didn't. So a lot of parents would go through the same thing, and then they think that suddenly it has happened. No, it doesn't happen suddenly. I'm sure pediatric experts can see children even as young as 6 months and start seeing the symptoms. Now with research, that they're saying that they're able to see the symptoms, ASD symptoms in children who are as young as 6 months. But how does a mother know who doesn't know how to observe those symptoms? And the younger the child is, the faster they start helping the child. The faster is the I would put recovery in double quotes because the child is not actually recovered, but the score falls down from 26, 27 to the score goes to like 18. I've seen children who are 18 months old who come. We just play with the child. We try to teach the child age appropriate skills, because the gap between them and the typically developing children is very narrow. You just fill the gaps and you reassess them after 6 months. Then the child is caught up with the development and is able to do things like typically most of the time, 90% of the time. And even if there are one or two here and there quirky behaviors of ASD, uh, you know, you can easily, nobody will notice unless until people like us are in the room and constantly observing the child for that one behavior that we don't want. Otherwise, nobody will, no untrained person will be able to notice, because now I have seen in my experience, so many children have come very young, Isha, and they just, it's like they do so well after therapy. After a few months only you can start seeing significant speech will improve significantly, social skills will improve, all their behavior issues will fall in place. Sensory, once OT is done, sensory issues will get resolved, they start eating everything. So it's really, to start early is the best thing. So it doesn't really happen at suddenly at 2 years. It has definitely started much before, at least a year or a year and a half before. Yeah.
So that's what I mean. You're right there, and I always feel that parents should have like a checklist, like maybe an app or something like that, where they can just see that the child's development or the evaluation is going on the track. Just
Yeah.
a screening,
Yeah.
something like that, and
Yeah.
there is no harm. Just keep a tab on the
Yes.
development of the child. Because
Yes.
if the child comes, as you rightly said, after 2.5, then the delay is much more. The gap is much more. So
Yes.
as early as they start, as early as they come to us, we can help the child much more.
Yes. Yes, absolutely. The youngest who has come to us will be, I think, 14 months or something, you know. But unfortunately, when we tell them to start immediately speech therapy, they somehow feel that it's too early and they don't start. They wait for another couple of months, and in that months again the delay will be much more, you know. But like especially in the US and all, they start very very early. They just don't delay even one day. They start immediately. Then you also see significant improvement in children. So I think early intervention is the early diagnosis, early intervention. Yeah.
One thing that I want to tell each and every parent, and I came to know about this only when I studied clinical psychology, that
Mm.
any skill that the child needs to learn, the child can learn only till the age of 5 and 6.
Yes.
Right. Then learning a skill, a different skill, becomes more and more difficult, more and more difficult. Right.
Yes.
So if you have waited 6 months to teach the child, for example, in speech, like you rightly said right now, so you have wasted 6 months of the child to learn a new skill.
Yes.
Right. So that is a huge time frame.
It's like there's a window that is open during the developmental age. It's like there's a window that is open, and that window closes after some time. And if you are
Yes.
going to if you only expose a child to a certain environment, certain language, certain whatever that you are trying to teach the child, if you don't expose the child to that, and that window closes, the same thing that
Hmm.
probably takes 6 months to learn naturally,
Hmm.
developmentally, it
Hmm.
might take even 2 years. It might take even 3 years,
Yes.
4 years to learn. I've seen children who couldn't speak like a 5-year old even when they're
Hmm.
15, you know, because
Hmm.
window is closed, you know.
Hmm.
So what happens is the delay gets adding up. It keeps piling on, piling on, piling on, and then till language is like language learning is like a pyramid. You know,
Hmm.
certain basic skills have to be achieved for the next level of skills to be learned.
Hmm.
Without having the
Hmm.
basis, the next level of skills cannot be learned. You know,
Hmm.
so it's like a layer. The niche wala layer, if it is not there, upar wala layer will not come. Lot of parents will say, ma'am, usko sirf conversation karana hai. Ma'am, aapko just, you have to teach him how to speak. But before that, there's so much that happens.
Hmm.
You know, like my speech therapist says, ma'am, how do I teach speech? The child doesn't have these basic prerequisites for learning language.
Hmm.
So I think parents don't understand. Again, they don't know. It's not that they want to
Hmm.
trouble us
No,
or
it's not
anything.
their fault. Yeah.
They're just anxious and they want somehow their child to
Hmm.
speak.
Hmm.
But there's a method in which it happens, and there is a time in which it happens. If the
Hmm.
time is missed, and then you have to still go through the same process.
Hmm.
There's no fast tracking it, you know. It has to be done. You can't skip stages. It has to be learned in that many stages, and the same stages will take much longer if the window is closed, you know. That's why we say early diagnosis, early screening. But for 1.5, we don't call it autism. We don't,
Hmm.
even if it is 2 years, I would still wait for a month or two. I'll tell the I would say suspected autism, high risk for
Hmm.
autism. I would still be very choosy in the ways, the words that is used, because there's no point in labeling a small little child. Then we'll say, okay, 3 months, then we review more frequently. Then
Hmm.
if we are not labeling
Hmm.
a child, then we are reviewing more frequently, because we
Hmm.
don't want parents to think that there is no autism if there is, you know. So we always review. In every 3 months we review, and then the next 3 months, if we still see the child is not progressing and it is autism, then we definitely want to call it autism. We don't want to waste time, because then the whole
Hmm.
therapy the thing will change. What therapies that are being done will change. So if we are little uncertain also, I would always I would give it a benefit of doubt, and I would not call it ASD. But if I'm certain, I would rather call it ASD at 2 than not call ASD if I'm sure, you know. So because I've been there, I've wasted a lot of time with my son, and I know how much he missed out because nobody told me, and they have lost the time. I don't want parents to lose out time. It is for their benefit. When I tell them label, it's because
Hmm.
it's for their benefit, for their child's benefit. As I told, in India, we don't have any agenda. We just diagnose and we start doing therapy. Anyway, it's mostly private, parents are paying for it. Whereas it is in the US, labeling has a very big implications, has a lot of implications, because the insurance comes into the picture, the state comes into the picture, it's state funded, and so what happens is they delay the diagnosis. The moment the child is diagnosed in the US, the state has to step in and start supporting the child. It's a cost implication for the state, for the country, or whatever it is. Okay, so in India, we know that we don't have such system here. Nobody helps here. Yes, there are one or two NIMHs here and there, but they are catering to a certain category of certain economic strata. Certain economic strata of people would not like to go to places like that, which are not up to the mark. Okay, anyway, you're going to do private therapy. Why can't we start early then? Why are you delaying the diagnosis? We don't have to copy the West, especially the developed countries, because our system doesn't work like theirs. You know, that's what it is. So yes, I'm taking off on a tangent. I'm sorry, but I feel that the point that I'm trying to make is, yes, it doesn't start suddenly at 2. It would have started at 6 months of age. And if you have noticed any changes in at 1 year, start immediately, because the gap is very, very little to fill. And if it is 1.5 years, start immediately. If it is 2 years, the moral of the story is start immediately. Whatever age you see any differences, start immediately. Don't wait. No waiting and watching. That's my message. Please don't wait and watch.